Assalamu alaikum. I am Asad Yusuf and welcome to MPT channel. Today's topic is effectiveness of quality assurance and management program in radiotherapy. So we're going to emphasize on quality assurance and management. Definition: quality management, all activities designed to achieve the desired quality in treatment. Control, activities that forces a specific quality on a process. Quality assurance, activities that demonstrate the level of quality of the process. So the objective of this presentation is to brainstorm about can we improve the efficiency of our quality assurance. Quality assurance efforts are increasing with the new modalities and technology. Can we change our approach? Can we learn from other organizations? Are we open for that? The current quality management standards and their focuses on quality management and quality assurance guidelines measure the functional performance of radiotherapy equipment by measurable parameters. Set tolerance at desirable but achievable values. Quality assurance and quality control perspective examples are TG40, 142, 198 recommendations. And you will find all these modalities in our country as well and abroad. So what's on the cancer patient mind? Safety, of course. This is the first thing which the patient has in his mind. Radiation therapy accident articles of accidents one has to keep in mind, and some other reports. And you can find on the roses and also in saffron. And these are the reports published internationally, and some other reports you will find on IE website as well. Can current practice help in preventing such events and meet the safety challenges? Main goal of quality management: patient will receive the prescribed treatment correctly. The failure of quality management, insignificant error in dose to the target, major events that can injure or kill the patient. Where the failure occurs, keeping equipment in calibration is essential. If some problem found, how long had it been wrong? As RTQA guidance is focused on equipment performance, although most RT events have resulted from human performance failure. Just performing all recommended QA might not provide protection against the event. Example, annual calibration of the neck. It takes several days to complete. If everything checked out, the effort was mostly wasted. That is, could span checking things with a higher probability of failure. If some problem was significant, then daily checks should be in place to prevent it. Example, IMRT, the major fluence map for IMRT QA. This is certainly something that we would want to have correct. However, the system has been commissioned and then used correctly. Why would this be wrong for the patient? Since one may think about it. So if you worry about the leaf movement, even if the fluence map indicates correct movement for the first day of the treatment, why do you think it might be correct in a week? Are there problems found this way? Almost never. Do we need QA for the leaf movement? Maybe daily. So these are the questions one may ask by themselves, or what kind of rigid QA system they can set for their organization or institute. So problem with the current QM, the example suggests that QA is performed currently might not be optimal use of physicist time. Just performing all recommended QA might not provide protection against the event. So pressure on the medical physicists to implement new technologies, lack of guidance on how to implement, delay in publishing QA protocols. So what to do? There are multiple ways we can go through. The method of evaluating a QA need in radiation therapy, TG100 use some tools to develop new guidelines for RTQM. Process mapping, identify the process which are more error prone. And these are the things we can adopt. The fault tree analysis, establishment of risk-based QA program. So one has to understand this process. This is the flow of the patient, how the patient started the diagnosis, staging, and then IMRT planning started into databases, and then ended with the successful treatment. But during this process, these essential checks are really important for the patient management. So understand the process. assess the hazard that could degrade the quality, establish the failure propagation pattern, and test and evaluate redesign if need be. So one has to run all a failure FMEA on all these processes to understand where one could goes wrong. So the best way to avoid potential errors some step is to redesign the procedure so that error is not possible. Re-evaluate after redesign because new possible error may have been produced. Consider the key component identified by WPM TG100. Training, communication, standardized policies and procedures. And one example, I have already shared the lecture on nomenclature, and you can find out on my channel as well, the standardized policy of the nomenclature used in the radiotherapy. And this is an essential component for the communication, of course. And the communication is one of the most important part in radiotherapy. Patient-specific QA assumption for MLC, that assumption we have discussed in the previous slides. So MLC shape used for each patient covered the range of lead and position used in all patients. Sensitivity of plant tested during 1 day or week is adequate to detect the problem. Frequent of the new MRT provides sufficient MLC check to prevent MLC delivery error. Geometric and dosimetric accuracy goal over course for MRT interception. So these are the quality management one could design for their institute. Where to put the resources? Recognize that processes have higher failure than equipment. Assess the highest risk and address them. Think toward QC and QA explicitly. Be open to new approaches. The summary of this presentation is when establishing quality management for your facility, use the risk assessment tool to determine what needs to be protected. Organize the QM step by QC and QA. TG100 approach provide a concrete process-centered approach that consider the interaction between the network of devices, staff, and process and RT. Remember that you can't do everything. Our job is not to prevent error, but to keep the error from injuring the patient. So it's useful to report all accidents before consequences appear. So be remember, near misses are very important to report. Thanks for listening and keep enjoying our channel. Thank you very much.